Welcome to Twins World, all about parenting. As I was thinking what all the topics need to be covered in childhood, and suddenly the teething came into my mind because one of my students' child started to have this teething issues and came up with fever. So when she asked about doubts on that, I thought, okay, this also can be an issue where parents may be getting troubled when the children are getting their teeth. So I thought let me talk about teething first, and in the next episode I may address how to remove the teeth of a child. So these are the, even I cannot say it is a small issue. Yes, for another person it's a small issue, but for a parent, and that too first parent going through this process, it is something that can be a concern. So what is teething? If you come to that question, a teething is the process of developing teeth in a baby, and you can expect the teeth or the tooth in a baby as small as 3 months of age, or you can expect the first tooth to be developed at 6 to 7 months. Somewhere down the line we can see that some children come up with very delay in having this tooth eruption. This is mainly because of calcium deficiency or vitamin D3 deficiency, and if you go to a doctor by 6 or 7 months, if the tooth is not erupted, they may give the supplement and immediately the teeth come out. So this is the way the teething process occurs. Usually in children, the tooth that can be erupted first will be the lower teeth, lower in front, the small teeth. We call it as incisors in science. If you see what are the signs of teething is, you cannot expect a particular sign, but the babies may have a continuous drooling of saliva of this particular age. And teething is not a painful process for everyone, but some children are very irritable because they could sense that something is popping up from their gums. So how we can take care of this particular phase where teething is on process? We can put a bib for the child so that whenever they drool and walk around, we can wipe them, or when they move around, then wiping with a towel. It's always good to have a bib there so that you can wipe the saliva that is on their face. Second thing is you can give them teethers so that it is a rubber material or a plastic teethers, whereas the child can nib or bite so that the irritation what is happening on the gums can be avoided. And it is a very common practice that the children keep on taking and putting things on the mouth, especially of this period, and they keep on chewing or nibbling on things. So this is a very dangerous thing because the child can come up with any kind of infection. So very common myth which is very prevalent in most of the culture is teething can bring diarrhea and fever in children. Even my mother said it's a normal thing that the child can get a fever or diarrhea at the time of teething. Actually, it is not common. It is because the child is putting things on the mouth, the child get an infection which results in fever, which is a sign of infection, and loose motion. So understand, it is not because of teething the child is getting fever. It is because of the infection or unclean thing that the child has kept in the mouth can produce this fever. So as mother or father, what I can do is clean the area around the child, clean the things what they can grab or they can bite. You can see when the child is biting the handle of chairs or any kind of table. So it's our need to keep on watching where they bite and clean the area so that we can introduce less infection in children in this particular age. So now we'll see how to clean the teeth. I already explained in previous sessions that even though the baby is a newborn, actually you can clean the mouth with your fingers, clean fingers. This no one teach anyone in the initial days. But what you can do is, as a mother or father, I can clean my finger, index finger or whatever. Then I can put it in the gums and clean the tongue, gums, and inner part of the cheeks and the upper palate and everything. I can clean with my finger. So this way I can continue. And as the child is going to have the first tooth with two teeth, you can use the finger brushes that is very soft. With that also you can clean the same process what you're doing with the finger, now using a finger brush. And as days goes by, I already explained in another video that you can use the brush, whereas baby paste will be available, which is less fluoride content, can be used with a pea-sized amount, so that not much amount of the paste can be gulped in. And as the child grows up, we can increase the size of the paste what we are using in the children. Make sure the child doesn't come up with dental caries. If the child is having dental caries, it literally shows that parents are not taking care of the children's dental care adequately. That's why the child is up with dental caries. So hope the thing is well explained to you. If you have any queries on the same thing, you can text me or message me or mail me in the address what is given in the description. Till we meet with the next session, stay safe and stay happy. Thank you.